For the last 3 decades, one man more than any other has been the scourge of the orthodontic establishment. And he lives here, in this slightly unexpected castle in the depth of rural Sussex. His name is John Mew, and he's an experienced dentist. But he also had orthodontic treatment when he was young, and he's blunt about what it did to him.
I'm a perfect example of why you shouldn't take teeth out.
In Britain, the most common treatment for children with overcrowded and uneven teeth is to use fixed braces, often accompanied by extractions. Mew believes that's wrong. Instead, he argues for an alternative approach. And there is, he says, a way to compare the results.
Here, for example, we have a pair of twins. Both of them had irregular teeth, but Quinton, the one below, was more severe. I treated him while Ben, his brother, with the milder problem, was treated by a traditional orthodontist.
Although Ben and Quentin Creed are identical twins, their treatment wasn't. Like tens of thousands of other British children, Ben had 4 teeth extracted and the rest braced. Quentin, on the other hand, was treated by John Mew without extractions. Instead, he used a technique designed to expand his jaw to make room for the teeth. What's happened to their faces?
Well, you can see that Ben's face is slightly flatter and slightly longer, whereas Quinton has more forward growth, which I think perhaps gives him the slightly better profile.
Today, in their early 20s, the twins are happy that at least people can now tell them apart. But Ben, who received the traditional treatment, does feel John Mew's approach would have left him with a better result.
I think in some respects it elongated my face. Because of the extractions, I've got a smaller bite size, and so the width of my mouth is smaller. So therefore the smile isn't as pronounced.
Well, there's a clear comparison between us as twins for the 2 different methods, and it's evident which method seems to work in favour of the orthodontistry method of Dr. Mew's. Really.
All orthodontists and all dentists I talk to know that faces are from time to time damaged. They don't attempt to deny that, but I think they are worried that it might put patients off treatment.
Mew's argument goes like this. A normal upper arch should look like this. It forms that way because the tongue rests in the area between the upper teeth. There, it counteracts the pressure of the cheeks, which would otherwise push the upper arch of the jaw in. But if a child sucks his thumb or breathes through his or her mouth for any reason, then the tongue drops from the top of the mouth and the upper arch can get pushed in. Nor is that the end of the process, according to Mew and the critics. They say the narrowed upper arch has a knock-on effect on the lower jaw, forcing it further back and down. And it's that, they say, which gives the appearance that front teeth stick out too far. The critics' treatment is based on changing the posture of the jaws and expanding them to fit the teeth. Brentwood in Essex, and dentist Francois Rossau, another critic of British orthodontics, welcomes 8-year-old patient Katie and her mother.
Hi, Katie.
Hello, Katie. Katie has a very common problem, uneven teeth which appear to stick out at the front. But, says Rossau, Katie shows why you must look not just at the appearance of the teeth, but the jaw as a whole.
I'll do this simple test. I'll just cover Katie's face there. I'll bring the paper down slowly, up to about there. And if you look at that, can you see anything wrong with her face? Does it look as if her top lip is sticking out too far?
Her face looks absolutely fine, and her top lip is not sticking out. It looks exactly right.
So that's not where the problem is then. If we look at her full face, see, that lower jaw is too far back.
But the trouble is that traditional orthodontics would actually say, well, she's got sticking out teeth, it's crowded, so we'll take some out and move that back.
That's what normally happens. The danger is if we pull the top teeth back, that will lock the lower jaw even further back.
Another dentist to come out against the mainstream is Mike Fennell. And in his case, the evidence was very close to home, his son David. 10 years ago, on the advice of an orthodontist, he extracted 4 of David's teeth. But when David's brace came off,